blood pressure control can actually be a short-term or a long-term regulation. So if we're looking into the short-term regulation, you're usually focusing more on altering the peripheral resistance. Because from previous videos we've already discussed, it's pretty easy to alter the resistance. Simply vasoconstrict or vasodilate, and all of a sudden you have a different resistance. But that is not something for a long-term regulation. That's short, get it done, over with, go back. If you're trying to look for more of a long-term regulation, you're looking more for the actual volume of the blood to be altered, either to increase the volume or decrease the volume. By increasing or decreasing blood volume, it can then be maintained a little bit easier at those points. But that's more of a long-term regulation. So what you do is go through different mechanisms that will impact the short term and then get to the ones that impact the long term. So first we'll look at neural pathways, neural processes that are going to impact your short-term blood pressure regulation. So first off, we're looking at these neural pathways altering peripheral resistance, which means we're looking at mean arterial pressure here. Because MAP, or mean arterial pressure, can be altered very easily by altering blood vessel diameter. So you're looking at blood distribution here. Because depending on what's going on with your body, sometimes certain areas need more blood or less blood. Take for example, let's say you're working out, but you're focusing on your arms. Well, your arms are really working, you're doing a lot of movements. You have a lot of blood flow to those muscles because you need more oxygen and more nutrients. But do you really need a lot more blood flow to your legs if you're pretty much not using them very much? No. So you're controlling blood flow to the area that needs it. We'll get to this more in the respiratory section, but in the lungs, if there's areas of your lungs that have high concentrations of oxygen, you'll then send the blood there to pick that up oxygen. But if there are areas that are low oxygen or high carbon dioxide, you won't necessarily send the blood to that area because you need to get rid of the carbon dioxide. You don't want to pick it up. So your lungs are constantly controlling blood flow as well. So this whole idea of neural control is occurring to alter where the blood's going to where it's needed to make sure that's adequately supplying your blood into the different parts of your body, into the different organs, the different structures. Is trying to make sure everything is maintaining that homeostatic balance, or at least being supplied with until it can get back to the homeostatic balance. Now, these neural controls a lot of times are dealing with via these reflex arcs. We talked about reflex arcs back in AP1. The idea is something is a stimulus, it triggers it, sends that signal in, you process, send out something to change. That's obviously a very shortened version of it. But the idea here is you have several different areas that are impacted. Looking at your vasomotor center, your vasomotor fibers. They're helping control the actual functionality and movement of the vascular system there. You have your vascular smooth muscle. We've dealt with that before. That's what allows you to contract and vasoconstrict, or simply relax and it vasodilates. You also have your baroreceptors. Baroreceptors are pressure receptors. They can monitor the pressure inside the blood vessels. So all of these can play a part in feeding into that neural reflex for short-term pressure regulation. But again, that's only one aspect of it. Because keep in mind, blood pressure is a very complex series of events all coming together to maintain it. Because as you move throughout the day, from laying to sitting to standing, to exercising, to sitting down again, you're constantly changing your pressure, sending blood to different parts of your body, altering how it's working. And all those need constant feedback. Neural is just one aspect of that feedback. As that neural system is giving feedback, it's feeding back into the cardiovascular centers. Now, these cardiovascular centers, Well, there's a cardiovascular center to increase heart rate, increase stroke volume. Now, the cardiovascular system, or the cardiovascular center, is going to work via the sympathetic innervation. So sympathetic stimulation is going to trigger your heart rate to go up. It triggers increased contractility of the cardiac muscle as well, and it increases your stroke volume. Do all that, you're increasing cardiac output. More cardiac output is pushing to more resistance. You're increasing your pressure. So if you start to exercise and your blood pressure goes up from exercise, the cardiovascular center is responding to the need you have in your body. But on the flip side, you have a cardioinhibitory center. Now, the cardioinhibitory center, decreasing heart rate, decreasing stroke volume, is meant to lower the output, slow down the heart, less blood is leaving. And this is all done via parasympathetic nervous. This parasympathetic nervous is primarily the vagus nerve. Hopefully that nerve, vagus nerve, rings a bell from AP1, is one of the cranial nerves. So the vagus nerve will slow the heart rate down. It will decrease the stroke volume. Now it can decrease the stroke volume because 1, you've slowed the heart rate down. 2, your contractility isn't quite as strong as it was. Therefore, you're altering the ESV and systolic volume. So we have these cardioinhibitory centers. Now, the vasomotor centers themselves are controlling also your smooth muscle tone. So now we can also control the pressure based on the smooth muscle in the vessels. Because we already dealt with the heart, that was the cardiovascular and cardioinhibitory centers. But now we can also now work with the blood vessels. If you vasoconstrict a blood vessel and nothing else is changing, again, these are all fluid, very balanced systems. So usually one thing changes, something else also changes. But for this case, nothing else changes. So all you do is squeeze. Same amount of volume, same amount of blood. Therefore, you've increased the pressure because you're squeezing the same amount of pressure, vasoconstriction. So you're changing the diameter here, which by changing the diameter, you change the pressure because the resistance has increased. Because as you squeeze down, more resistance is happening, more contact, therefore pressure is changing. And if you change the pressure, we know you change the flow. So all of this, without any other outside factors, can simply change your blood pressure. So there's many different ways to monitor, many different ways to alter, just based on this neural pathway to start with. By increasing pressure, you're increasing the force on the baroreceptors. By increasing the pressure and the force on the baroreceptors, then the baroreceptors increase input to the vasomotor center, saying, hey, we have more pressure here. This is what's occurring. So you're aware, your brain, your body is aware, hey, pressure is increasing. Now, if it's during exercise, that's expected. But if you're simply sitting there reading a book, that wouldn't be expected. So the body has to interpret then, okay, we have an increase in pressure. Is this supposed to happen and it's good, or is it not happening and it has to be corrected? So what's going to end up happening here is you inhibit the vasomotor center. That causes arterial dilation. Now remember, the arterioles were the main aspects for resistance in your blood flow. So if they are vasodilating, that means they'll have less resistance. Blood pressure is going down. At the same time, you can, if it's a large enough increase, have venodilation. The veins open up to try and drop their pressure on their side as well. So you end up having these responses to the stimulation of the baroreceptors. Now this overall then also stimulates the cardioinhibitory center. By stimulating the cardioinhibitory center, you're going to slow down the heart. You're going to decrease the stroke volume. Everything here is trying to decrease the pressure increase. So if that pressure went up and it wasn't supposed to increase, all these are kicking in. Now, if the pressure went up because you're exercising, that's a different story. You need that to feed all the muscles and everything that's working. So your body's monitoring and it has to assess, is this supposed to happen or is this a problem? Should it be corrected? Now, if you stop exercising, the pressure goes back down via these mechanisms because you don't need to maintain a high blood pressure after you finished exercising. Sure, there's the oxygen debt and you're getting the whole lactic acid moving, getting everything back to the way it was. But once all that's recovered, the pressure should steadily be dropping down. Now, the baroreceptors in the carotid sinus have a very specific function. They're actually protecting the blood supply of the brain. Because the carotids go up the neck, they're supplying the blood up into your brain. Now, yes, there's the blood-brain barrier there, but still, you have to maintain a certain pressure. And the key thing here is, you might notice it sometimes, from laying to sitting to standing up. If you do that too quickly, from laying, jumping right up straight, you might occasionally notice, hey, you feel a little bit lightheaded. That might occur more frequently if you're dehydrated. Because again, remember, dehydration can decrease fluid volume. But the thing is, your body has to change the blood pressure. When you're laying flat, there's an equal flow going across the whole body. But when you stand upright, all the blood wants to drain down because of gravity. So you have to increase a little more pressure pumping up into your head to make sure you keep blood in your head. If you can't keep an adequate blood flow to your head via these carotids, that's when you start to feel a little lightheaded, you start to feel off. A lot of times you sit down or lay back down, relax for a few moments, and then you can get back up again. But these carotids are constantly monitoring the blood pressure inside your neck. Therefore, they're monitoring the pressure going up to your brain to make sure that's the adequate pressure, not too much when you're laying flat, or increase the pressure when you stand upright to counteract gravity pulling down. Now, baroreceptors in the aortic, so this is the aortic reflex now, they're mainly looking at the pressure throughout the systemic circuit. So how much pressure is head to foot? So these help to monitor and regulate then the pressure overall in your body. So you're thinking that, oh, I have 110 over 80 pressure, or I'm 120 over 80, whatever it is. That's being monitored more by the aortic reflex here. So the carotid is really focusing with the brain. The aortic is focusing on the rest of the body. Now, this aortic reflex doesn't work by itself because there are other different baroreceptors throughout major vessels in your body. All those are giving feedback to monitor what's going on. So let's go through this and kind of get an idea of how this is all coming together. So we'll start with this initial one looking at the blood pressure has increased. And we're going to say this increase is not what you want, which means you need to correct it, get it back lower. So you have these baroreceptors in your vessels are going to be stimulated more than normal. Those are going to say, hey, we've got a problem here. Send information to the brain. The brain realizes there's too much stimulation. There's too much pressure. So the brain figures that out from the vasomotor centers. It's going to tell one, the heart, via a decrease in sympathetic activity, to slow down, have less contractility, reduce your stroke volume, and therefore reduce cardiac output. But at the same time, it'll also work on the blood vessels. The blood vessels will vasodilate, they'll open up to decrease pressure there as well. By having this work in multiple areas, you don't need one to have a huge change, just small change, small change, small change around. They all add up to making a large change. It allows for all the parts and pieces to work together. Ultimately, cardiac output goes down, resistance goes down, and your pressure is going to drop. All right, shifting over. Blood pressure drops too low. Now, you don't want this low blood pressure. So what ends up happening now again, those baroreceptors don't have enough stimulation now. Because they don't have enough stimulation, they are sending information to the brain. The brain says, hey, there's not enough stimulation coming from the baroreceptors. We better increase pressure. To do that, we're basically doing the opposite of what we just did. We increase sympathetic stimulation to the heart. That's going to increase heart rate, increase stroke volume via contractility, and increase cardiac output. But at the same time, we're going to increase the vasoconstriction in the vessels. Vasoconstrict, you're going to increase resistance. Overall, this causes cardiac output to go up, causes resistance to go up. That's going to increase blood pressure, bringing it back up to what you wanted as your normal homeostatic balance. These two processes, from too high back to normal, too low back to normal, are constantly occurring every day, every minute of the day in your bodies. It's a constant roller coaster. If the pressure gets a little too high, let's bring it down. If it's a little too low, bring it back up. The goal, though, is to maintain. But anytime you lay down, sit up, stand up, start moving around, stop moving around, your body's altering the blood pressure to match what's going on. It's all about trying to keep things level in your body. So a little about the neural and then the baroreceptor mediated processes for the short-term regulation. So short-term, we're talking minutes, maybe hours, but it's not going to be lasting for weeks or months.